First, I wanted to introduce myself. My name is Jessica Levin, and I am the Chief Program Officer at Let's Talk Menopause, which is a national nonprofit changing the conversation about menopause so women get the information they need and the health care they deserve. Just a few housekeeping items for information purposes. This talk is intended for informational purposes and not to be a substitute for professional medical advice, diagnosis, or treatment. Before we get started, we also have a few housekeeping items. We have disabled the chat and we'll only use it to provide you with relevant links. So definitely look at it because we have some great links during this menopause talk. And please ask your questions in Slido, which you should see here in the Zoom. We have reserved time at the end when our panelists will answer as many questions as possible. There will also be a very brief survey at the end, so please stay on and fill out a few questions because we want to make our talks as responsive to your needs as possible. So our menopause talks are a crucial part of Let's Talk Menopause's educational efforts. And I think this talk today is an incredible example of what information we are trying to provide you. I wanted to introduce our two amazing speakers. The first is Dr. Gillian Goddard, and she is an endocrinologist and an adjunct assistant professor of medicine at the NYU Langone Hospital. She treats patients with menopause, thyroid disease, PCOS, and diabetes with a focus on nutrition and weight loss. And she has a particular expertise in endocrine diseases affecting women during the reproductive years, pregnancy, and through perimenopause. She's also the author of Hot Flash, a newsletter from Parent Data by Emily Oster. And next we have Megan Dahlman. Megan is a sought-after professional trainer for women over 40 who want to be strong and live a long, energetic life. She draws on her 17 years of professional training, a degree in exercise science, and certification as a strength and conditioning specialist to make fitness and nutrition simple, doable, and most importantly, sustainable. She has a top 0.5% ranked podcast, Self-Care Simplified, and very popular online training programs and courses. So I wanted to thank you both for participating in this menopause talk, which we have called Balancing Act, Strength, Weight Maintenance, and Metabolism during perimenopause, menopause, and beyond. So we are going to start with Megan teeing up the 3 questions we hope to answer in this menopause talk. Thank you, Megan.
Yeah, well, thank you so much for having us. And we're honored and excited to share with everyone today. And hopefully the questions that we can answer for everyone listening today is specifically, we want you to walk away with tangible takeaways. I don't want people to walk away with just some ideas. It's always helpful, but I think it's more helpful to be able to walk away and say, I have something tangible that I can start doing today, something simple. So we want to make sure that you're walking away knowing what you should be focusing on the most in midlife when it comes to your strength and physical fitness. Like, what are the most important things? What should be your highest priority right now when it comes to your fitness? And then what are those clear action steps that you can begin doing today? That's what I was talking about, just keeping it super clear. So step number 1, step number 2, this is where you can begin. And then we're going to get even more specific with practical and simple exercises that you can actually do. We actually have pictures of movements that you can start doing when it comes to beginning to work on your strength. So hopefully everyone walking away from both Dr. Gillian Goddard and myself, you can walk away thinking like, wow, that was so practical. And I have some very doable things that I can do right away.
Thank you so much. To set the stage for to answer those 3 questions, Dr. Goddard, I'm hoping you can talk a little more about First, what is going on hormonally during this time? What does the data show? And then we're going to turn to what is going on metabolically.
Yeah, so what's happening hormonally is pretty well understood at this point. Um, as we're getting to the last reserves of our ovaries, hormones from the pituitary gland that drive egg maturation, and those hormones are follicle stimulating hormone and luteinizing hormone. Those hormones are going up. They're trying to stimulate the ovaries to do as much as they can to keep ovulating. When we when those hormones go up, two things can happen to estrogen. One, estrogen can get really, really high. And the other thing, it can get really, really low. And then as we progress through perimenopause, we spend much more time with our estrogen low than high. When our estrogen levels are low, a lot of times our testosterone levels are staying about the same. And so we have this shift in the balance between estrogen and testosterone. And when that shift occurs, it allows some changes to occur metabolically. Um, some of those metabolic changes that Jessica referenced include things like the ability to store energy as fat in our midsection instead of storing it as subcutaneous fat in our hips, thighs, and arms. And that's really important because the fat that we store in our midsection is very metabolically active. It changes how our body responds to insulin, a hormone made in the pancreas. It changes how our body responds um, to the carbohydrates that we eat. And it changes sort of our overall energy balance and metabolism. The other thing that happens as our estrogen levels fall is we lose a small but critical amount of muscle mass. On average, it's actually only a pound or two. It's about a kilogram. And but the problem is it's a really important that's a really important kilogram of muscle loss. And the reason it's important is because muscle also impacts our metabolism, also impacts how our body processes carbohydrates. And this sets us up to potentially be on a cycle where we gain gain more weight, especially in our midsection, and then see further losses in metabolic function, which then leads to more weight gain, which leads to more changes in metabolic function. So we can set off a little bit of a spiral with just tiny changes in body composition.
Dr. Goddard, you said something about subcutaneous fat, the
Mhm.
difference between the abdominal fat that we seem to all get and the other kind of fat, which is before menopause. Can you just explain that a little more clearly to the audience?
Absolutely. So there's the more we learn about fat, the more we realize we don't know actually. Fat is fascinating. We used to think it was very inert. Turns out it's actually an endocrine organ. It makes hormones and does all kinds of things. But there's two types of fat, two main types of fat. There's subcutaneous fat. This fat like sits just underneath the skin. It tends to accumulate in our upper arms, our hips, our thighs. It's sort of what has traditionally been referred to as like a feminine fat pattern, where it's more in the hips, thighs, arms, and less in the midsection. The other type of fat is visceral fat. Visceral fat accumulates in our abdomen, around our organs, and not just under the skin. And the reason that difference is important is because visceral fat is actually causing a whole cascade of events. It promotes a very pro inflammatory um, milieu, and that can lead to cardiovascular disease, it can lead to diabetes, it can lead to all the things that we worry about getting later in life and all those chronic diseases we would like to avoid. Visceral fat is an important player in developing those diseases.
Um, that's great. Thank you so much. I wanted to turn to the first question, to understand what women should focus on the most in midlife to build and maintain their strength and physical fitness. But before we go there, I wanted to raise something that is on my mind, and that is that this period of time in women's life, the commodity they have least of is time. So they can have a very stressful life, often do, with children, parents, work, and and then the demands that, you know, strength or weight maintenance can seem all consuming. And so I guess what I want us to really understand is how you can, integrate this in a manageable, achievable way, as opposed to just creating another source of anxiety and shame. And so I didn't know, before we go to what to focus on, whether you can address this significant conundrum women face.
Yeah. Yeah. I think it's really helpful to understand that any kind of fitness journey is a journey. And it's common for us in our history to come at it from an all or nothing mentality of, I'm either in a phase of my life where I'm working out all the time and there are 30-minute long workouts, 45, 60-minute long workouts. I'm working out every single day, or I'm doing nothing. And unfortunately, society, we've gotten some pressures from our culture and even from influencers that will say it's important that you're working out this much. Like, this is the gold standard. And so we feel like unless it's that much, it's not worth doing. And nothing could be further from the truth. Even if you do have progress that you would like to see, if everything that we're going to talk about today, when it comes to building muscle mass, improving your strength, improving your metabolism, sometimes it feels like those are big mountains to move. And how could doing just a 5-minute walk move that mountain for me? That can feel really overwhelming, and it can feel like whatever I do is not going to be enough. So I might as well do nothing. But the thing with fitness is that it's a journey, and it's a game of momentum. And if you can just get the ball rolling and start to gain some momentum with something that feels comfortable, something that feels familiar, something that's not daunting, something that you don't have to put your life on hold to do, then that will start to gain some momentum. And 6 months from now, 12 months from now, I think everybody would raise their hand and say, yes, I want to do something sustainably, that I'm still here doing this 12 months from now. If you start slow and gradual and gain some momentum, that's going to ensure that it will be something that you're still able to do 6 months from now, 12 months from now. And that's where the big changes really do happen. So sometimes we have to put it off to the side of what's the gold standard of what I should be doing. I'm supposed to be exercising 5 hours a week and I can't do that right now. It's like, well, what can you do? And give yourself grace for whatever that gap is between what you can do now and what you feel like you should be doing.
I
Dr.
also
Goddard, do you have
think,
anything to add?
yeah, I also think that, one of the things that the literature really tells us is it's not even just, do you exercise or do you not exercise? It's how sedentary are you?
Yeah.
And right. So it's, you can exercise, but then if you sit down at the end of that 30 minutes and you sit in front of your computer and you don't get up all day, that's not doing you any favors either. And so even just doing things like making sure that you are getting up every 45 minutes or hour, go walk out to the mailbox, go run upstairs and grab something, just move. If you're in an office, walking to the bathroom can be, depending on the size of your office, that might be a half block walk there and back. Just moving throughout the day is actually a way to build in some activity that's really important. And we know that just getting up and moving throughout the day is important, and it doesn't need to be exercise. It's
Yeah.
just moving.
Well, and there's actually like a term for that, what you're talking about, and it's called NEAT, or
Mhm.
sometimes it's something else, but non-exercise activity thermogenesis.
Yes.
And for someone who is just a mover throughout the day, their metabolism, and you can correct me if I'm wrong here, Dr. Goddard, but they've seen that metabolism can be as much as 10% higher in someone who has a significant amount of this NEAT.
Mhm.
So don't underestimate the power of these little things, of standing at your desk, of taking the stairs, of parking at the back of the parking lot and walking all the way in. That can be enough to see a huge difference in your metabolism and the leanness and healthiness of your body.
Absolutely.
That's very helpful. And I think that's a great frame then to ask the question, what are the outcomes? If you can give us a few outcomes that you are seeing women interested in achieving, and or the outcomes that you actually discuss with them when they're your client or patient.
I mean, I think for me, a lot of times people coming to me talk about the number on the scale, and I'm the one kind of redirecting them away from the number on the scale to thinking about overall body composition and other metabolic measurements like how is your average blood sugar looking? What is your blood pressure like? Because if we can focus on a more holistic picture of metabolic health, that's going to set people up for the long run so much better than just focusing on reducing a number on the scale, which may not actually be the right goal at all.
Mhm. Yeah, I find a lot of women that want to get started with a fitness program, they'll come into it with like one thing on their mind, like that scale number. And
Mhm.
then you start to uncover the layers and you realize that the things that end up being more important to them are, am I healthy? Am I strong? Can I do the things I want to be able to do for as many decades as possible? I had one client one time told me, she said, I don't want to spend the last 10 years of my life in a hospital bed. And I have parents that I've been taking care of, and that's where they're at. And there's so many things they could have done in midlife that they never did. And I want to make sure, whatever the number on the scale looks like, I want to make sure like I'm doing what I can now to ensure that I'm fit and active and healthy for as many years as I possibly can be. So I love the shift of mindset that can sometimes happen in midlife. You get this a little bit grander perspective, and I appreciate that so much because then it pulls you away from just being so focused on the numbers, which can be discouraging because sometimes they just don't move the way you want them to move.
Well, so
That's so true.
one
It's
thing you said,
also
go ahead.
There's also a lot of data around fitness, and we can talk a little bit more about this idea of like in the literature, what do they mean by fitness? But there's a lot of literature around fitness and what is now being called health span. So not
Mhm.
how long you live, but how long you live healthy, able to do the things that you want to do, and fitness is a key component of that. And a lot of what they're talking about with fitness has to do with balance, has to do with your ability, your agility, climbing stairs, bending over, and not necessarily about a lot of the other numbers. It's a very, I mean, it's a validated but very qualitative sort of goal.
Mhm.
So it's interesting because Liz, even prepping with both of you, eh, the areas you emphasized the most to me were strength training and muscle building.
Mm.
So I was hoping you could define what those mean and why they're so important to what you call health span and fitness.
Yeah, well, we know that someone who carries more muscle on their frame is going to be more functionally active for more years, and the cascade effect of how that impacts their joint health, their heart health, their metabolic health. Your muscles are an endocrine organ. Like they impact the health of your entire body. So having muscle on your body is one of the healthiest priorities you could ever have. Strength training is a method of doing that. So the outcome of strength training is it will help you build muscle. There are various ways to build muscle, just not being sedentary. Like we got to start there. Like that's square one. If you don't use your muscles, if they're not having to contract and relax throughout the day, they won't be stimulated and they'll stop working. Like they will atrophy. So we have to be using them somehow. And then there does come a point where they need to be working against a little bit of resistance to get them to stimulate more than where they're at right now. So that's where strength training can come into the picture. And underneath the strength training umbrella, we have lots of different methods of strength training. So that could be resistance training. And there are many ways of doing resistance training. We can use weights, we can use weight machines, free weights, kettlebells, bands, your own body weight. This is one of my favorite methods of strength training because it's the most accessible and it's the easiest to start with. So that falls under that umbrella of resistance training, but we can also build your muscle through other methods of activity. It's just whether or not those are quite as effective at building the most amount of muscle on your body as some form of resistance training.
Can you just give an example of another kind of activity that can build muscles?
Running would build muscle. Swimming, your classic steady state cardiovascular type of activity. Anything that you feel your heart rate increasing, your heart is getting oxygen to muscles. So that is telling us that there's some muscles somewhere on your body that are asking for oxygen. And so those muscles they're working. Is it the most effective for laying down more muscle fiber? Not necessarily. So when it comes to wanting to, like, if your goal, which all of our goals should be, is let's put as much muscle mass on your body as we physically can, doing steady state cardio and other forms of activity that's not has some form of resistance to it, it's not as effective. It's still going to work those muscles. It's absolutely better than nothing, but it's not going to be quite as effective as having some resistance applied to those muscles.
Dr. Goddard, do you want to add anything to that?
I would add that this whole process of resistance training is not just critical for muscle and muscle mass, it's also absolutely critical for bone mass. Which is another piece of this entire puzzle. So, one of the things that happens in menopause is that women start to lose bone mass. And one piece of fitness later in life is having healthy bones, and it's a real key to avoiding frailty. Bones, when let me start again. When you pull on bone with muscle, it actually creates these itty bitty little microscopic bits of fracture in the bone. And those tiny little baby fractures actually stimulate the bone to come in and remodel and build stronger bone. So every time you lift something, every time you work against resistance, you're stimulating this process of bone building and muscle building. So you're really actually getting a twofer.
Yeah.
So a question I have about cardio then, because a lot of us, if we thought, if we wanted to get in shape at any point, we tried to up the cardio and maybe didn't do any strength training at all, any weights. But that has to flip in some ways after this point. Can you explain then how cardio fits into this puzzle?
So
Well,
you're,
I was gonna,
so I'll go.
I,
Yeah.
I was just gonna say, I mean, cardiovascular exercise is important for your cardiovascular fitness, but that's really just getting your heart rate up and increased, and it does not necessarily have to be running or doing an aerobics class or something like that. Any way in which you get your heart rate up counts as cardio from the point of view of maintaining heart health and cardiovascular fitness.
Yeah. Yeah. And it comes back to your heart rate. What good heart health is asking your heart to pump harder,
Mhm.
faster, and recover quicker. And so we can achieve those things. We don't necessarily need to go out and do like steady state running or the traditional forms of cardio to stimulate your heart. What I love about stimulating your heart health, your cardiovascular system at the same time as doing other forms of exercise like strength training. There have been a lot of strength training workouts where my heart rate is like through the roof. And I think a lot of people would agree with that, is that we're checking off so many boxes all at once. And this kind of goes back to that question that you had earlier, Jessica, about like, we're so strapped for time and feel overwhelmed about there's so many boxes I need to check. I have to work on my balance. I got to work on my muscles. I got to work on my flexibility. I got to work on my cardio. And I think what we're really craving is a routine that combines all of that together so that we can walk away from a 10-minute workout and realize I did everything I need to do for my health in that one thing. And I don't have to like go pick and choose and put together this like clip art of all these different workouts. So that's where cardio training can fit into the puzzle. It's absolutely important to be working your heart as much as you're working your muscles, but the beauty is that we can work your muscles and in turn work your heart at the same time.
Yeah, so I want to do a little plug then for Megan's website
Oh,
because just because she provides, I mean, you'll talk about it more, but this is what she is offering people, is how in a very efficient amount of time to address all these needs. And as I said, recognizing that time is our rarest commodity. I wanted you to briefly, because we're hearing a lot about like high intensity cardio workouts, low intensity. Can you just say a little more about what all that means and how we should think about that once we are menopausal or postmenopausal?
So the intensity really refers to the degree to which you're elevating your heart rate. So high intensity exercise is pushing your heart rate into a range that is closer to your maximal range. Often it like short intervals versus the other thing that Megan was talking about, moderate intensity steady state running, for example, that's a typical moderate intensity exercise. And then, stand like walking up one flight of stairs because you're going to take the stairs instead of the elevator, or walking from the far end of the parking lot into your office in the morning is most likely low intensity because you're probably not running that fast or working that hard to get your heart rate up, but you're still moving. And one of the things that we know about high intensity exercise in midlife is that it's stressful for the body to be at high intensity like that. And so it actually increases our stress hormone cortisol. And when you increase cortisol levels, you can, in someone who is predisposed, further cause more insulin resistance, and you can actually affect your how your body is processing carbohydrates negatively. So you can actually store more carbohydrates as fat instead of using them for energy. So I caution people to be careful with high intensity exercise because it can be counterproductive for some people.
the other thing with high intensity exercise is that it requires a lot of capacity out of your soft tissues. And unless like your heart might be able to handle it, but this is how a lot of women unsuspecting might get injured, and then their whole fitness routine has to go to the sidelines. And so unless you have a good progression to get to that point, not only training your heart and training your routine of knowing like, okay, there has to be recovery days, there has to be balance between light, moderate, high intensity, like until you're doing all that well, if you just jump into really high intensity training, yeah, you're pushing your heart really hard, but you're also stressing a lot of your soft tissues and your joints. And especially for women in midlife, this is top of mind as well.
Mhm.
And so you have to approach your routine with a much more wise method of like, this goes back to what I was saying. It's a journey and it can evolve. And if you get to the point where you realize this is okay, I'm not getting backfires when I'm working in this moderate intensity. Maybe I'll explore a little bit of high intensity and then recover really well from that. How did that go? How did I feel with that? Let's dabble with that a little bit more. How did my joints heal after that? How do my muscles feel? Rather than just like this black or white, all or nothing method.
Mhm.
Someone asked the question, is walking considered cardio or strength training or both? You suggested it was low impact.
Well, walking could be low or moderate impact, or low or moderate intensity, to be clear, depending on how quickly you're walking. If you're walking if you're in your sneakers and you're walking fast enough that your heart rate is getting into that 50 to 80% of your maximal heart rate, that would be moderate intensity aerobic exercise. It's strength training in that it's not strength training. It is may build some muscle in that you're using the muscles in your legs, in your butt, core. But it's not, as Megan mentioned, walking and running are not the most efficient way to build muscle.
So I think this is extremely helpful. There's some questions I want to come back to,
Yeah.
but I wanted to turn to weight maintenance. Because I know, as you said, people are showing up like
Mhm.
often concerned about their weight.
Yeah.
So I guess my first question is, after menopause, is it basically the norm for women to see weight gain around their abdomen? And do most women get that weight
Uh,
gain?
if my patient population is any indication, yes, it's incredibly common, and the data says that it's incredibly common. Even in women who don't gain weight, they will often see a shift in body composition, meaning that they will have fat in places that they didn't have fat before. They may have more or less muscle, often less muscle. Um, and so it is really difficult to go through midlife and look and feel exactly like you did maybe in your 20s and 30s. But I would argue that, you know, this is just one of a number of shifts in body composition. We all went through a big shift in body composition during puberty. That's also really common. And then, if you're someone who has been pregnant in the past, that that leads to shifts in body composition as well. I think that I think we have to be a little gentle with ourselves in expecting that we're going to move into another phase of life and not see any change. And in all fairness, some of my patients who are thin and have not gained weight during perimenopause, they may not have gained weight, but they've definitely maybe picked up some fat around their midsection, and so then they're thin, but the weight that they do have is in their midsection, and they tend to be the most unsuspectingly unhealthy patients that I see. They think that they've won the game, so to speak, because they didn't gain weight, but what actually happened is they lost muscle and gained fat in their midsection, and that then leads to negative metabolic.
Well, and I feel too, if I could just add to that, I feel like when it's not normalized, that body, our shape does change, and that's okay. When we feel like it's not normal, that's when we get panicky.
Right.
And we start to do extreme things to try to fix it. And I think from a fitness standpoint, what a lot of people will start to do is that they'll run to all the ab exercises. They'll go try to find all of the exercises that target that spot that they don't like anymore. And we've done this in the past. It's like, oh, I've got bat wings. I got to do all the tricep exercises. Or we kind of pick and choose exercises. And I think it's really important to understand too that you can't spot reduce fat. You can spot strengthen. So sure, if you were to do a bunch of abdominal focused exercises, your abdominal muscles would get stronger, but that wouldn't reduce abdominal fat. And I think that's where we end up. It leads to a lot of injuries, a lot of compensation patterns get developed, a lot of it's just an imbalanced routine if we're coming at it from the place of like panicky, I got to do everything I can to change this part of my body that's changing. And rather than being like, let's take a really good, well-balanced routine and just make sure that I'm healthy and I have good body composition levels overall.
So it's interesting because, we were talking about weight loss drugs. So a question, I had is to you all is if you take weight loss drugs and you look thinner or lose weight, but you don't get stronger, like, are you creating additional risks for yourselves? And I wanted you to address that question and tell the audience your thinking about when the weight loss drugs are an important tool for women to explore.
Yeah. So, I think just to be clear, we're typically at this point in time talking about the group of medicines that are often referred to as GLP-1s, the brand names Ozempic, Wegovy, Mounjaro, and Zepbound. They are paradigm shifting medications, but in my opinion, they're not for everyone. Um, they are not magical. Um, they 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 don't replace following a healthy nutritional pattern and doing having a balanced exercise routine. Um, for some of my patients who are already really struggling with issues around metabolic health, so women who in perimenopause might already be struggling with prediabetes or diabetes, changes in their cholesterol pattern that are consistent with metabolic syndrome. Um, for some of those people, these drugs are an important tool for helping them, but they don't replace the things that we're talking about here, where we're talking about how to be healthy and fit in the long run. And my patients who have done the best with GLP-1s are patients who have had some signs of metabolic dysfunction to begin with. Often that's pre-diabetes. They typically have a lot of central obesity, so they have a lot of that fat accumulated in the midsection, not necessarily, by the way, through any fault of their own. A lot of that predisposition is genetic. And they're implementing the kinds of things we're talking about today, especially around strength training and exercise, while they are losing weight. And that allows them to maintain their muscle. GLP-1s themselves don't actually cause muscle loss. weight loss leads to muscle loss if you are not strength training while you're losing weight, because it just takes less muscle to move a lighter frame. If you imagine if you put on a 20-pound vest and walked around, it would take more muscle to carry that 20-pound vest around than if you didn't have the 20-pound vest. As you're losing weight, you're taking off the 20-pound vest. And so if you're not actively working to maintain muscle mass, you will lose it, regardless of whether you're losing weight with GLP-1s or through any other weight loss method.
Yeah, and I think it's helpful to remember too that like fitness journeys, they're hard. It is hard. And it is, like I said before, it's a momentum game. And if someone is severely obese or has a lot of excess fat and it hurts to walk, it hurts to move your body. And it's hard to say, okay, you need to start exercising more to get this fat off. How do you do that? Like it can be extremely discouraging. So I have heard some incredible stories of women who do start taking a GLP-1 and that's almost like the momentum that gets them going to now they have some more motivation and insight to be like, okay, now I have the capacity to be able to move more. But when I'm looking at helping someone be as fit and healthy as possible, someone's health is so much more than whether or not they have the right amount of fat on their body. And this is where the weight loss drugs are like one-sided. It really is only about like, well, how much fat do you have on your body? Is that a good amount? For someone to feel the best in their body, it comes down to how do your joints feel? Can you move throughout the day through full ranges of motion? Do you get tired? Do you have plenty of energy? Do you have stamina? Does your back hurt as you go throughout the day? Like all of those things matter because there's a lot of people that could lose a lot of weight and they still don't feel good in their body because all those things didn't happen too. So yeah.
I want to ask a question that someone asks in our audience. They ask, can regular strength training, exercise, and healthy diet counter the typical weight gain after menopause? So you put on this weight, you want to do what you can do to take it off. The reality is, will these things collectively make a difference, in your weight?
The
Yes.
answer is, I was going to say the answer is it depends.
They can.
It can to a degree. There is a subset of women who, with that weight gain, have developed a significant amount of insulin resistance. And when insulin resistance is high, so insulin resistance means it's taking lots of insulin to keep your blood sugar normal. And so I think there's a lot of confusion about what that term even is. But when you're producing all this insulin to keep your blood sugar normal, what that is doing is it's taking literally any carbohydrate you put in your mouth and storing it as fat in your midsection. And so when women have significant insulin resistance that comes along with that weight gain, and whether or not you do is to some degree genetic, there's a genetic predisposition toward insulin resistance or not, then it can be hard to diet and exercise your way out of that weight gain. But for the women for whom that's not the case, and not all women develop insulin resistance when they gain weight or significant enough insulin resistance to impede their progress, then I would agree with Megan wholeheartedly that yes, diet and exercise can be incredibly effective, or nutrition and exercise.
So Megan, it's interesting because our second question was, what are clear action steps you can start doing today?
Yeah.
So in answering that, and we have very little time because we want to get to more questions.
Yeah.
So I know this is obviously a long discussion, but in answering that, in terms of the strength, the muscles, the bones, and the issue of weight, can you talk a little more about that? What are the things that you would recommend?
You have to start somewhere, and usually the best place to start is the thing that has the least barrier to entry. And it it's most likely something that's familiar to you. So if the familiar thing is just putting on your tennis shoes and going for a walk around the block, I will support that all day long. Whatever you need to do to just get your body moving. But if you're already there, you're already doing something and you just want to start to dial things in and you want to start to dabble with strength training, I always recommend a great place to begin is following a really good core training program. The stronger your core is, like, we can check off so many boxes for your health if we can just start with a simple core strengthening program. And I put together a few exercises. These are the most beneficial core exercises for women in midlife. And you'll notice most of them are stabilizing and bracing style movements that work on building the muscles around your spine, your glutes, your pelvis, even your pelvic floor, your diaphragm. So working that trunk, not for the purpose of reducing belly fat, but for the purpose of creating a really stable trunk so that then when you start to add in a little bit more, maybe now you're used to doing a few core exercises each day in the afternoon or right after dinner or something. It's like, oh, now I can explore maybe bringing in a squat. I can explore trying, some push-ups on the countertop. Now you have a little bit more trunk stability and awareness on how to hold your body nice and firm and stable so that as we start to add some more exercises into the routine, the likelihood of you getting injured goes way, way down. And I know a lot of people won't start strength training because they're afraid that they might get hurt. And if we can remove that fear altogether, like, we're doing a really good job. So starting with just some basic core exercises, it's a really great place to begin. And those ones there that we demonstrated are perfect.
So someone asked this question. I'm 6 weeks post-surgery. After hysterectomy, I've been cleared to resume activity, but want to take it slow while focusing on core and pelvic floor. So would you say those kind of core, that your core program, that is that is a good starting point?
Yes.
Or do you have to do something additional because you just had surgery?
So abdominal surgery of any kind, whether it's a C-section or frequently hysterectomies will be vaginal. Sometimes they're not. I've even worked with women who've had appendectomies. So any sort of trauma in that core region, building back up the strength of those deepest layers of core abdominal muscles, you want to approach it from starting with breathing training first, learning how to inhale and exhale using the muscles inside your trunk, using your pelvic floor, bringing in some Kegel work, and then bracing. The types of movements you would want to avoid, and really I don't see a whole lot of use for them in a functional routine anyway, is anything with twisting, flexing, bending, lots of crunches and V-ups and things like that. It's not functional. It's not really how your core was designed to work anyway. And it's a lot of really direct abdominal stress. And so we would definitely want to avoid that type of core training. So the core exercises we showed there, my core training program, it is perfectly safe for anyone with diastasis recti. Maybe it's been years where they've never healed their separated abdominals from when they were pregnant, post-hysterectomy, post-appendectomy, just really weak core altogether. Those exercises are a great place to start.
A question I have though is, in addition to the core training,
Mhm.
can you talk a little more about the full body routine, a full
Yes.
body functional routine? What does that even mean?
Yeah.
How does that go together with the strength training?
Yes. And whenever I approach strength training, I always think of how does your body want to work as you go about your day? So usually as you go through the day, we use a lot of joints all together. rather than just doing like one single bicep curl or one little lateral raise. So I like to give exercises that accomplish a lot of movements in one, or use a lot of muscles in one. But if we think in the realm of pushing, pulling, so an exercise that has you pushing, an exercise that has you pulling, pushing overhead, pulling. And then with the lower body, we want to train it to be able to squat well and hinge well. Those are kind of the two big motions that your lower body should be able to do. And I would say hip hinging is number one. Everyone needs to know how to hinge. And I can show you that real quick.
I
It's
was
just,
actually going to ask you.
yeah, so just standing up and being able to hinge at the waist and come back up vertically without folding over. A lot of people will get injured, especially those with osteoporosis in their lumbar spine, because they've never learned how to hinge properly from the hip. So if that looked familiar to you, it's a classic deadlift position, deadlift motion. So working those glutes. So those are kind of the big movements that we can do, exercises that train those big movements of your body.
Yes, thank you. Thank you. I wanted to ask you, Dr. Goddard, because we have a number of questions. And they raise issues about different types of treatments and supplements and how they might be able to help with the puzzle. And the first one is from a woman most likely just past perimenopausal state, partial hysterectomy, kept ovaries, age 54. What is the clinical perspective vis-a-vis HRT and strength training?
So, I mean, I think that HRT, so there's not a lot of data that looks at the benefits. And I think when we're talking about HRT, in this case, we're mostly talking about estrogen. There's not a lot of, we know that withdrawing estrogen can lead to muscle loss. We don't have a lot of data that proves that adding the estrogen back improves muscle building. But there's so many reasons to think about adding HRT, and it's it's not going to be detrimental to your muscle building, and it may be beneficial. We don't have the studies where women were randomized to HRT or not, and then given, strength training exercises to do, or body composition tests afterwards to see if the HRT impacted body composition. But we think that it may be beneficial, and it's certainly not going to be detrimental. And there's lots of other reasons to consider HRT in that situation.
But in terms of osteoporosis,
that is the one thing that even the Women's Health Initiative agreed on. Estrogen is great for osteoporosis.
for prevention of bone loss.
Yes.
Correct?
I think the other thing that we know that it does is it helps with joint health too. I know a lot of women can experience things like frozen shoulder. That's huge. Just severe joint issues that can make you want to move less.
Achiness too, sort of generalized achiness is a common symptom.
Yes, and maybe not sleep as well. So when you're not sleeping as well, your motivation goes down to exercise. So it's kind of this like, nothing is in a silo, right? Like there's nothing that's like all on its own. Everything seems to have like one thing affects another thing. So will HRT build your muscles? Maybe not, but will it create a better environment so that you can more easily work on building your muscles? It might. So it's kind of like all the pieces together. It's a big puzzle, right?
So one quick question, someone asked about magnesium. What is your view about magnesium for these issues? Do they help? What do they help? What does it help?
So magnesium may help with sleep continuity. It definitely helps reduce headache frequency. So if you're someone who's experiencing a lot of headaches as part of menopause, magnesium can be helpful. There is some data about muscle cramping. So if you're someone who gets muscle cramps at night that disrupt sleep, there's some data that magnesium can be very helpful with that. And those are the main things for which there's data. Again, magnesium is one of those things that you might get a lot of benefits from, and the downside is pretty minimal, especially if you choose a formulation that agrees well with you as far as like not having gastrointestinal side effects. Some magnesium can give people some bloating and sometimes some frequent bowel movements, but there's several different formulations. Some people do better with like magnesium glycinate, for example, is well tolerated by a lot of people. I do always remind people to take it before they go to bed. It can make you sleepy, which is one of the reasons why it can be helpful with sleep continuity, but you don't want to take it in the morning and then feel like you're like slogging through your day.
So I want to flag one thing back to the question about hormone replacement therapy, because obviously there continue to be a lot of confusion and fears about hormone replacement therapy. On our website, and I think our CEO just put a link to it, we have 30 menopause talks over the last 2.5 years, and there are a number of them on the role of hormone replacement therapy in addressing sleep, joint pain, bone loss, mood issues, hot flashes, of course, which is the primary, one of the primary uses of it, and how that also then affects sleep. We don't have time to go into it now, but I would strongly encourage people to look at those menopause talks, because as our speakers have said, all of these things are connected with each other. If you're tired, if you're depressed, if you're in pain, whatever that is, it can really derail the quality of your life and your ability, especially to start down this path of, strength and metabolic health and long-term, quality of life. So we are going to release the poll. I wanted to ask very quickly, because someone said, do you have any inspirational stories of hope and success to share? So we just released the poll. As people do our short 4-question poll, I wanted one or both of you to give us some inspiration as we approach the next phase of our life, or some of us are already in that phase.
So one particular patient comes to mind for me. She, like many of my patients, is in her 50s, recently, newly menopausal, had, some emotional stressors in her life, in the last several years, and had developed some unhealthy coping mechanisms around food and alcohol. And when she came, and then she tried to kind of turn things around on her own. And when she came in to see me, she was so frustrated. She had tried to do a bunch of things on her own. She had taken a very like extreme, like all or nothing approach, and she had not been very successful. And so she was very skeptical that anything was going to be helpful for her. And what we ended up doing, she was pre-diabetic. She was really struggling with obesity. So for her, a GLP-1 was appropriate. But she also worked very closely with the dietitian in my office to make small, stepwise, sustainable changes to her nutrition. And she engaged in an exercise program. And again, she was starting from zero. And she feels great now. She feels amazing. She has so much energy. She's feeling so much better that the last time she came into my office, she was hugging all of the staff and and me and the dietitian, And she had been so skeptical that anything was going to make a difference. She was so fatalistic. And so to see her, and it took a long time, it took her about 18 months to make these changes. But to see her really at the other side of that, continuing to move forward and feeling so much better was really
Thank you. Megan, any short words of inspiration that you have for
Yeah.
us? As we listen, please, everyone who's on still, please just fill out the poll. It's very quick.
Yeah,
Thank
yeah. I have thousands of women I've had the opportunity to work with that are, I like that you use the word skeptical, because at this phase of life, we've all tried something at least once, if not many, many times. And so I can understand the skepticism of trying something and maybe doing the slow and steady route. And one person comes to my mind, she's 58 years old. And a year ago, she was suffering from just debilitating back pain and hip pain. And that was preventing her from even exercising at all. So we took care of the back and hip pain, got her core stronger, improved her mobility, allowed her to be able to actually move without pain throughout the day, and then slowly built from there. A year later, she's lifting 25, 30-pound weights. She just moved houses and moved all the boxes in her home without any back pain whatsoever. And she said, I never thought that we could reverse how I was feeling. And she was like, I can't imagine like stopping this. So little simple steps in the right progression do work.
So I want to, on behalf of our audience, thank both of you so, so much. I think each of your individual expertises is incredible, but I think even hearing you both together, it's more illuminating for us. So I think you've given us all a gift. After I prepped for this call with you, I started telling people all the things I learned from you already. So I wanted to thank you both so much. And I wanted to thank our audience.